Hello everyone, welcome to the Tech Talk presentation. Today we are discussing about the reason for completely ban smoking from public areas. Myself, Sai Teja from Department of Tribuli. Why smoking is banned in public areas? Now we can see in this presentation. Reason for completely ban smoking from public areas. Today we will see smoking bans or smoking-free laws are public policies, including criminal laws and occupational safety and health regulations that prohibit tobacco smoking in certain spaces. The spaces most commonly affected by smoking bans such as indoor workplaces and buildings open to the public, such as restaurants, bars, retail stores, hospitals, libraries, transport facilities, and government buildings. In addition to public transport, vehicles such as aircrafts, buses, watercrafts, and trains. However, laws may also prohibit smoking in outdoor areas such as parks, beaches, pedestrian plazas, college and hospital campus, and within a certain distance from the entrance to a building, and in some cases private vehicles and multi-unit residences. The most common retinol cited for restriction on smoking is the negative health effects associated with the secondhand smoke (SHS) or the inhalation of tobacco smoke by persons who are not smoking. This includes diseases such as heart disease, cancer, chronic obstructive pulmonary diseases. The number of smoking bans around the world increased substantially in the late 20th century and early 21st century due to increased knowledge about these health risks. Many individuals and organizations such as World Health Organization (WHO) support smoking bans on the basis that they improve health outcomes by reducing exposure to SHS and possibly decreasing the death of people. Rantanol. Smoking bans are usually enacted in an attempt to protect non-smokers from the effects of secondhand smoke, which includes an increased risk of heart diseases, cancers, chronic obstructive pulmonary diseases, and other diseases. Laws implementing bans on indoor smoking have been introduced by many countries, and other jurisdictions has public knowledge about this health risk increased. Air qualities in bars and restaurants. Restrictions upon smoking in bars and restaurants can sustainably improve the air qualities in such establishments. For example, one study released on this website of the CDC states that New York State wide laws to eliminate smoking in enclosed workspaces and public places sustainably reduce levels in Western New York hospitals venues. Public health law researchers. In 2009, the Public Health Law Researchers Program, a national program office of the US based Robert Wood Johnson Foundation, pub- published an evidence brief summarizing the research assigning the effects of a specific laws or policies on public health. They stated that there is strong evidence supporting smoking bans and restriction as effective public health intervention aimed at decreasing exposure to secondhand smokes. Effects upon health. Several studies have documented health and economic benefits related to smoke ban. A 2009 report by the Institute of Medicine concluded that smoking bans reduced the risk of coronary heart diseases and heart attacks, but the report authors were unable to identify the magnitude of this reduction. Also in 2009, a systematic review and meta-analysis found that bans on smoking in public areas were associated with a significant reduction of incidence of heart attack. The lead author of this meta-analysis, David Meyer, said that this review suggested that a national-wide ban on smoking in public areas could prevent between 1 lakh to 2 lakh 25 heart attacks in United States each year. Effects upon tobacco consumption. Smoking bans are generally acknowledged to reduce the rate of smoking. Smoking-free workplaces reduce smoking rates among workers and restriction upon smoking in public places reduce general smoking rate through a combination of stigmatization and reduction in the social cues for smoking. The World Health Organization, thus WHO, considered smoking bans to have an influence on reducing demand for tobacco by producing an environment where smoking becomes increasingly more difficult and to help shift social norms away from the acceptance of smoking in everyday life. When effectively implemented, they are seen as an important element of policy to support behavior changes in favor of a healthy lifestyle. However, reports in this popular press after smoking bans have been enacted often present conflicting accounts as regards prescription of effectiveness. On report stated that cigarette sales in Ireland and Scotland increased after their smoking bans were implemented. In contrast, another report states that in Ireland, cigarette sales fell by 16% in the sixth month after implementation of the bans. In the UK, cigarette sales fell by 11% during July 2007, the first month of the national-wide smoking ban, compared with July 2006. As 1992 documents from Philip Morris summarize the tobacco industry concurrent about the effects of smoking bans, total prohibition of smoking in the workplaces strongly affects tobacco industry volume. Smoker facing this restriction consumes 11% to 15% less than average and acquired at a rate that is 84% higher than average. Economic impact. Many studies have been published in the health industry's literature on the economic impact of smoking bans. The majority of these government and academic studies have found that there is no negative economic impact associated with smoking restriction, and many have found that there may be a positive effect on local businesses. As 2003 review of 97 such as studies of the economic effects of face smoking bans on the hospitality industries found that the best designed studies conclude that smoking bans did not harm businesses. Similarly, a 2014 meta-analysis found no significant gain or loss in revenue in restaurants and bars affected by smoking bans. Thank you.